Good evening. It's my pleasure to call to order the April 20th, 2023 committee meeting for policy of the School District of Haverford Township. This is the rescheduled meeting from April 17th, 2023. We'll start with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And I'll turn it over to Dr. Rushi to get us started for tonight's agenda.
We organized the agenda tonight into two components. One, previously reviewed policies that we're continuing to work on and hope to be able to move forward. And then the policies, there are 4 of them that we will be looking at for the very first time this evening. So we kept them separated so that we can hopefully get through the looked at more than once. With respect to the ones that are more than once, I want to apologize. I moved some of those policies over because we have been talking about them before. And in moving that list, I should not have moved over 627, district-initiated real estate tax assessment appeals. That policy, there's nothing, we've not made any of the revisions to that. So it is not, and I apologize because I am assuming there are some people who are here this evening who thought that would be on the agenda. So we're not doing anything with that tonight. No, you don't need. I'm sorry that I didn't see that ahead of time.
I also don't think it was previously reviewed in substance. I think that last time Justin gave an update, just that it was being looked at. Yeah. So we haven't. Just in case someone is watching and thinking they talked about this before, we didn't talk about it before.
Is it anything to do with like how you talked about it before? I mean, this came up years ago, didn't it?
Right now, it's just in draft, and we don't have a draft that the committee is ready to look at. So it's not, and like I said, it wasn't talked about before our attorney. So there's been litigation about
the policy itself.
No, we haven't talked about the policy itself. There's been litigation that is related to it, and that's what the update was last time from our attorney, but we don't have a draft policy. Outside of the school district, yeah, went up.
Do you understand that case and the implications and how it's a split decision?
We have attorneys advising us on it, yeah.
Okay. You really do understand the depth of it.
Thanks.
It's important. Thank you.
Sorry to make you come out here.
Sorry again.
Okay, thank you.
Enjoy the rest of your evening.
The first policy that we will start with this evening is 203. We had reviewed that previously. There were some suggestions, requests, comments that the board made. You have those revisions in front of you. You had asked at the time to add to the definitions both the AR and the policy so that all 6 or so definitions would be included on that policy document. So you can see that all of the definitions have been added to the policy document. I will go through the changes that are there, and then if you want to ask more specific questions, Justin might be the person to answer. But in the purpose section, there was a question about can we link to the state statutes and regulations that are noted there. I wasn't sure, Justin, if it just wasn't linked because it's not a live document, or if that's something that you're not recommending, that we put links to other websites within the policy itself. In the authority section, the request was that we would add the identifier of Pennsylvania Secretary of Health, so that has been done. And there was a question about the wording religious grounds, and if that has been defined in school code, and Justin informs us that that has not been defined, so there's no specific definition for us to attach to that. And in the delegation of responsibility, there was a request to clear up the footnotes, and those footnotes have in fact been cleared up. And within the AR, the change that was made there was just, the definitions moved to the policy and noted as such.
comments on the revised draft? I see that we've looked at this one in December.
A couple of
and
times.
in
Yep.
March, and here in April, so, it's gotten a good work over by the committee. Any comments or questions on the version here?
On this or the AR. 'Cause,
Mhm,
you know,
yes.
Ideally, we'd like to move both forward.
Together.
At the next meeting.
And just for clarification purposes, or just, a reminder, I know you're all aware, but when a policy goes forward to the board for its first reading, there's still opportunity to, ask questions about it, to look at proposed wording changes. It's just typically not at the magnitude that it would be when a policy is still in committee, but it doesn't mean that you or any of our, of your fellow board members couldn't continue to ask clarifying questions or ask for some changes to that.
Yeah, I appreciate you saying that too, because not only are we able to make revisions between the readings, because we have a first reading, second reading, and then a final reading, and that, when it's actually adopted, but we can actually move it back to committee, which we've done before. So, as much as I would love it if everyone who watched our general meetings also watched our policy meetings, it does happen a lot that we don't get public comment on the policies until it's actually at the general meeting. And we have had it before where we hear from the public or we get comments from the board, and then we decide, there are substantive changes that need to happen, and so then we move it back to committee. And then there's able to have a more robust discussion on the policy at the committee. So, one thing that I think that we would like to see is for the policies to move quicker through committee and utilize some of that full board reading. Even if we don't see, every single change yet that we want to make, we have capable counsel who is able to take our suggestions and put it into words, and then at that point, move it into a first reading. And so I do think going forward, we're going to try and utilize that process a little bit more and a little bit more efficiently, so that we're not, so that my 2-year-old has graduated from the school district of Haverford Township before our policy audit is complete.
That's a good goal.
Yeah, she should be still in the district when the policy audit is complete.
And you will see that I have 2 of my colleagues here this evening. That will start to occur now as an assistance with the process of keeping things moving, because what some board members may not be aware of, we receive a draft policy from Justin, and that's not presented to you immediately. So for example, with some of the policies that we're looking at now, Nicole has taken that. She's met with nurses. She's talked with principals in the building, and are bringing that forward. Some of the later policies that we'll look at, Jen has met with the building principals to look at. So my hope is by having them here, maybe some of the questions where I have often said, oh, I'll look into that and I'll get back to you. Hopefully if the administrators who've been leading the internal discussions, and that's going to increase as with the policies that we're starting to move through as well. So we'll look to have some of these folks here with us.
And that accomplishes another goal that this committee has stated of trying to make sure that the policies as drafted reflect, to the extent possible, the actual practice, the input from, on the day-to-day, so that our families, our staff can relate to it, understand it, and then follow the policies to the best they're able. So that input is helpful to have as the drafting is happening, and not, like a worst case would be to have it go and everybody say, wait, what, this isn't right.
Yeah, we really welcome your input on the practicalities of what the implications would be for these policies, right? Because we, I can speak for myself, I think that my other board members feel the same, but we don't want to be a board that sort of rules on high without, the understanding the implications that would have and whether it would work in practice. So I appreciate you both being here. I appreciate all the work that goes into us having the policies to look at. I know that Dr. Rushi and you both and other people on your team look at them before it even gets to this. So the policy audit I think is important, but it certainly isn't without significant effort. Thank you.
So I do have a question.
Oh, good, okay.
So I'm looking at the AR under health records, and my memory's a little bit fuzzy, but I thought that we talked about, do we have a district physician?
Yes, we
We
do have
do.
a district physician.
Okay, and that is a person that is like on an as-need basis, or how are they employed or contracted by the district?
It is a contract.
Answer your question?
Okay,
It is a contract, so they're as needed. So
Okay.
our nurses reach out, I might reach out to them, other people in my department reach out to them when we have a question, or if they'll do the physicals for students who require physicals, who don't have like their.
primary care.
Yep.
Okay, all right, so when I'm looking at the nurse or district physician may use such, et cetera, that last sentence there. I am on the AR under health records, and I'm looking at that very last sentence in the first paragraph. You see the nurse or
Yes.
districts, okay. May use such reports. And so is it that we use the district physician when there is a potential concern that the nurse cannot address, or always available for whatever's needed?
Communicable
Oh, okay.
diseases.
So policy 209 is the communicable disease, so that's.
So 203 is communicable disease.
Diseases.
There is a
Mhm.
district physician defined in policy
Am I in the wrong
209.
policy?
Mhm.
You're in the right policy.
Okay.
It just
Okay.
references
Okay.
209, so that's what I
Okay.
thought we were.
Gotcha, okay.
So, they would reach out to the district physician for, yes, communicable disease, and, we do reach out for other things when we have questions that, a physician might write a note that we can't interpret.
Gotcha.
We might ask our district physician to help us understand what, they're trying to get at, what the school needs to do for the student.
Okay, all right. Thank you for clarifying.
Got it.
So I couldn't hear what was said down there. Are we in 209? Is that what we're in?
I'm sorry.
We're
in-
still in 203.
That's what I thought. Okay, so there
Okay.
was a mention of 209, so I got confused.
The
Okay,
last
perfect.
line has
That's
209
203 is what
mentioned, so I
have
just wanted to make sure I was.
Yeah.
Right, there's some cross-references.
Got it,
Because
got it.
several of these policies approach health services in the district from different
Okay.
topics.
I appreciate the revisions that were done, since our last discussion, which I'm seeing, incorporated here.
Okay. Are we comfortable moving it forward to the full board for the first read?
Unless anybody has an objection, I think so.
No, I would say the only other thing to highlight with this one is so much of this and other health policies are tied back to Pennsylvania state code and regulations, and what these policies are doing are really showing how the district is committed to complying with those, rather than crafting our own course through prescribed health services.
Yep.
Okay, so this one will go to the full board at an upcoming meeting.
You think these will be on next Thursday's agenda or after that?
What I was going to propose is, let's see at the
Yeah.
conclusion of this meeting how many we have.
Okay.
And if we want to, I'd try to get some forward.
Yeah, especially this one, I don't think we're making any revisions to it, right? And
Mhm.
so it'll just be as is. So hopefully we can bring this, start moving it forward, in front of the full board.
I don't remember, when we move it forward, do we clean up the document or do we keep it as is?
I think what we usually have,
We clean it up.
onto the agenda is a clean
Is
copy.
it clean? Okay.
Mhm.
Yeah,
It's a little hard
Yeah,
to
it's
decipher sometimes, so,
Yep.
yeah.
cause that's available to view for the public too, and I think that would be very confusing.
Yeah,
for
I
them.
agree.
209, the policy itself, that has, 209 has both policy and an AR, but the policy itself, the only thing that was changed within there was to title the policy Student Health Services and to clean up the citations.
Yes, yeah.
There was a little more activity with the AR.
I did have one question. Is the requirement to include the BMI, is that a law that requires us to do that, or is that something that we are just doing out of practice and habit?
So I believe it is referenced within the school code.
Okay,
I believe it is referenced within the school code.
Yeah, we're required to do that.
You can speak up.
Yeah, we have to do that. We're required to do that.
okay, that's, I just wanted to make sure there was a law that required us to do that.
So on the
The
AR.
AR, yeah, there was a few things on the AR. There was a request to insert a definition section that would define district physician and district dentist. There was a request within the general requirements section to add the words "as explained further below." And you see that at the conclusion of the reference to CHIP, the Children's Health Insurance Program, and indicate that it is explained further below. The addition of a reference to policies 203 and 800. There was also a request to add that, and then to actually have the CHIP information added.
I think that was in, we just wanted it moved up.
Yeah, to a more prominent location there. Within private examinations, there was a request to just reword that final sentence to sort of bring a greater clarity to that, so you may want to look specifically at that. See some of the language that Jason removed.
So, yeah, I still had some comments on the ARs.
There were a couple more changes.
There were a
too.
couple, yeah, I wasn't sure.
Yeah.
Go ahead.
You paused there,
I think
I
it's
wasn't
good
sure.
to go through all the
Mhm.
changes first, and
Yeah.
then we'll go through comments.
In the health services section, to add in, after the given by, right in that very first sentence there, to actually note it as the school nurse or qualified medical clinician, medical building assistant. We removed item 4, the test for tuberculosis, and verified that we in fact can do that. Page 4.
It was also removed that a teacher would ever be giving one of these tests.
Mhm.
So we put it up front, that it would be a school nurse, modified, or qualified medical technician, medical building assistant. And then within each bullet point previously, it also had the potential of that being a
Of a
teacher, and so
yes.
that was also removed. And that was a comment from last time, so.
Thank you. Page 4 of the AR, under the parent guardian notification section, we added that the parents would have it in advance. That's in that first sentence there. Emergency care information was moved. And the records retention policy was referenced in the maintenance transfer, destruction of health records.
I still had some additional comments, some of which are just, maybe cleaning up. There's places where we've added definitions, but the phrase isn't showing up as highlighted as the definition. One definition that I think this policy would benefit from, because the concept is used several times, is the in lieu examination, a private examination. Throughout it kind of talks about a private examination at the parent guardian's request and expense, and but I think it might be simpler to have that be a defined term.
The in lieu of examination, is that what you're saying?
Yeah, and it kind of shows up in quotes in a couple of places, but I
Can you
think
just,
Is that
is there
from a
one
statute?
place that it, okay, the private
the
examinations?
private examinations,
Okay.
there's, under
I see it. I
examinations,
see
under
it.
private
Mhm.
examinations,
And-
under parent guardian notification, like, it comes up enough times that I think having it be defined would be more clear that we're talking about the same thing.
Just like a private / in lieu of definition at the beginning of the,
Yeah, and then we could just call it, whatever, private examinations, or,
What, does the statute use in lieu? I assumed that it did because it's in quotes.
I think it does.
Yeah.
okay,
I think it does.
so, yeah,
It
using
sounds like
that
something
language.
that we wouldn't have come up with, or we previous, the 2010 board, whenever this happened.
Mhm.
But, I mean, if we can just call it a private examination, that is a much more accessible term than the in lieu
Mhm.
of. And so maybe like what you're saying, Bridget, we define it as private / in lieu of, and then just refer to it as private examination
Right.
throughout. Because that's just a more accessible term, I think, to folks.
I guess though, to Bridget's point, there's multiple times.
Mhm.
I didn't realize the in lieu of up above in the examinations. And then, so if I am unfamiliar with looking at this, I would think, is this the same in lieu
Yeah.
of
Right.
as the one below, or are they meaning something different? So that's a good point.
Okay.
So let's add that definition and then use it throughout.
And then, the place of examination, one concept, the second paragraph talks about if the facilities in schools are inadequate for conducting an exam, that we could make arrangements for the use of laboratories and facilities of hospitals or clinics. And I was curious, like, under what circumstance would our school, health facilities be inadequate for the general expectations? Like, are there circumstances where we need to make arrangements for use of laboratories and clinics and hospitals?
Not for us, no, our facilities are meet.
Right, so then I
Yeah.
wondered if we should instead approach it as like the policy of this board is to say the district must maintain adequate facilities to conduct the medical, dental, and other examinations for, our board policies.
I'm actually wondering if,
To the approval of
I guess the
Secretary of
word
Right, like-
inadequate or adequate can sometimes have a negative connotation. So I'm thinking that we're meaning we may not have the proper or required resources on site. When I think of inadequate, I think of we're not up to standard, and I'm not sure that is what we're trying to convey, unless it is. Versus we may not just have the resources that a doctor's office would have.
Mhm.
But whatever is
The
expected
necessary.
of public schools in Pennsylvania, I think I would prefer knowing that our board's policy is that we have the facilities and the resources to provide that level of care, and that should be a standard that's maintained.
Does that, I'm not being facetious when
Mhm.
I ask this, does that mean that we will have to bring back the dental chairs?
We still have the dental chair.
Okay.
Where does the dental chair live?
I think it lives down the hall actually right now.
You have the dental
chair.
And so
But is that in a situation where then, if a school doesn't have a dental chair, we are required to send children to a dentist's office?
I honestly don't know if a dental chair is required for,
That
The dental
that we
exam.
do.
Okay.
you know, if a dentist comes in, I'm not sure they require us to have a specific type of chair. It's easier for them if they're using that type of chair, just because of the way the child will lay and everything, but I'm not sure, I'm not a dentist. so
That
I
the
can't-
dentist would say no.
Yes, that he can't, I don't know, count teeth in a non-dental chair.
So, yeah, that was just a suggestion as I was reading this workaround. I felt like
Mhm.
we should be able to provide whatever is adequate to deliver the health services as required and outlined.
Then do we need it at all?
Maybe just the affirmative statement,
That was
that the
gonna be my-
district shall maintain.
That was gonna be my recommendation. I mean, if you wanna change the phrasing of it, you can. But to Dr. Rushi's point, you could also I mean, because this is one of those things where it's optional if there's an issue with the facilities, but as Ms. Battistelli said, there's not an issue with facilities here, and if that becomes an issue, there's a standard and there's a process, as it's stated here, and that's directly from the school code, so it's really up to the pleasure of the board.
We could just strike that paragraph.
Yes, if you look at the prior paragraph, it does say, you know,
Right.
and other examinations in rooms set aside for this special purpose and equipped with adequate facility, like, that's our policy, that we're going to have adequate
Yep.
facilities with,
I
just
prefer
strike
that,
that
strike that paragraph.
okay.
So we're gonna strike the second paragraph in place of examination.
Mhm.
I just want to double check, if we strike that second paragraph, it still allows us, if there is a special situation that needs something that we can't provide, right? Like, I'm just thinking there might be a student who has a disability that requires some kinds of equipment we don't have on hand, or something that does allow for us to be able, but like, we're still able to pursue that even if, like, we get rid of that second paragraph.
Dr. McKay, a lot of the revisions or additions to these policies were frankly adding extra sections of the school code, but in practice, I think that the district's already doing, and it was just memorializing it within the policy, so.
Yeah, it seems fine to me to then just scratch that second paragraph with the understanding that there might be someday one case, but overall that we have the ability to do it in-house.
In the paragraph that we are keeping in that section, I just would suggest having the last phrase, as may be required by the Pennsylvania Secretary of Health for the thorough health examination of children, instead of leaving examination broader there. In the next section was called private examinations. It talks about, when the exam is supposed to happen no earlier than 4 months prior to the opening of the school term. Is term always understood to be the first day of the school year? Or sometimes I think of like, oh, it's a new marking period, it's a new semester, and didn't know if that could be clarified.
Yes.
Okay. Under health services section, where we're listing out the types of exams that students have. The last one, numbered, mine's still labeled 6, but maybe it'll move up to 5. Such other tests as the CDC or other ACIP may deem advisable to protect the health of the child. And that struck me as different than the other ones, which seem to apply across the whole student population. So does this mean on an individual basis, it's the child, or is it, or tests by the CDC or ACIP that would be advisable for all students enrolled? Or all in a grade like some of the other ones
And can we
are?
just change the word child to student?
Right.
Because, so it's consistent.
Yeah. Do we give health exams to non-district students?
Yes, we provide health exams in the non-public schools in our district.
But still would be
Still student,
a
right?
student, maybe not just one in our buildings, but yeah, I just read that like, because it said the child, it made it sound like an individual case, which I'm not sure this policy is meant to be pointing out. So yeah, just to broaden that to protect the health of students.
Of students.
Okay, that's helpful. Later on, under that health services, it talks about if a parent, guardian fails to report the results to the district physician, the district physician shall arrange a special medical examination for the student. And I wondered if we needed special in there, or would they just arrange for a medical examination? Like if the parent, guardian didn't take care of that, it's not a special thing, it's just the exam.
A medical.
Yep.
You don't need the descriptor.
If we can just go back up, the paragraph below number 6, that one still has child instead of student in the last sentence.
It does,
So
yeah.
the student needs to advise a student's parent, guardian.
Mm-hmm.
I'm gonna write in my notes that Justin's gonna do a sweep for the word child.
Yes.
Yeah, when you're not in a PDF, it makes it a little easier too.
And then, so parent guardian notification, I liked about being notified in advance. And then I was just curious, is it true that a parent guardian is encouraged to attend if the examination happens at school?
They're permitted to.
They're but maybe we don't want to say encouraged in the policy. That seems, I was like, I don't know that that would be a practice that we need to have parents like encouraged to go to a
So,
routine
yeah.
medical exam at school, but
Is permitted.
permitted would be, yep. And then I think this is another paragraph where it starts to get confusing about what is the alternative, and that's where we would have the defined private examination.
Can we go back up to the paragraph that says if a parent / guardian fails to report the results? And so the district physician shall arrange a special medical examination. I'm assuming that is as a part of a dialogue, conversation, consent with the parent or guardian? Not. Can we add some language the way that it's clear that we're not just saying, hey, you didn't do it, but guess what, we did it for you, without them being aware of what took
Is it a
place?
different section, like any, I thought I read another, it might not be in this policy because they're all
Okay.
blending together right now in my head.
I think that's what the section below says, though. The
There's-
parents or guardians of students who are to receive an exam shall be notified in advance. So that would fall under this.
Under that, I just think it's helpful though, if we could either include that below or just have it so that it's clear that that's not happening without the parent being notified or given some sort of consent, which I'm sure that's what takes place anyway.
Dr. King, what if we just reference, shall be notified in accordance with the provision below?
Yeah, that's helpful. Yeah, the way they know that it's clear, we're doing it already, it's out there for everyone to see.
I'll go on, there's a section called religious exemptions, and it starts off with a student or their parent guardian if the student is a minor, and it just felt like that should be switched around, right? Because the preponderance of our students would have the parent or guardian taking that action, and then a student if they are not a minor. And then it talks about the statement that the medical examination is contrary to their religious beliefs, shall be examined only when the Pennsylvania Secretary of Health determines that the student presents a substantial menace to the health of others. And I was like, one, I wondered, is it like, really does the Pennsylvania Secretary of Health, or do we mean someone in the health department, determines that a student like needs a medical exam? And then is menace a word in code, or can we talk about
So
a
that-
risk or something like that?
So that entire section is directly from code, so I would hesitate to say, I mean,
All right.
practically, it's probably not
Oh.
the actual secretary, but I would advise against changing that.
Okay.
Yeah, I totally
Just because
agree.
that's the standard.
I would like to put a little like note, like this comes directly from code, this guy, like.
Well, do we have a footnote? I guess we don't have footnotes in the AR.
We typically do not, I
Right.
mean, well,
That's fine.
we have been, I mean, we can certainly add it, that's not a problem.
I think it's fine.
I think it's fine, it's just my
It
little
comes
pet
directly
peeve
from
when, right?
code. It is what it is.
It is what it is, I will live with that. In the emergency care section, in the second paragraph, it talks about, will carry out the procedure as outlined in the superintendent's regulations. And then, is the superintendent's regulations something different than this?
Bless you.
Bless you.
Excuse me, thanks.
That's probably procedures that we, like, we have procedures in terms of contact,
Okay,
contacting this building, like, depending on the nature of,
so it's
if a
understood what
parent
those
can't,
are.
if a parent can't accompany a child, then, you know, if they need to be transported to a hospital and a parent can't accompany them, then we usually have someone, but that's not policy, it's procedurally how we kind of do
Mhm.
things.
Okay, it just
So-
seems like
Yeah.
we're talking about, these are administrative regulations, and then it's like, oh, there's outlined in a superintendent's regulations. I don't know if there's another way to describe that, or
Well,
the school
I'd rather take it
procedures
out.
or
I'd rather
something?
take it out and just have it read, and, shall place the responsibility for the care of the student with the parent or guardian as soon as feasible.
Yes, I agree.
And just cross out, shall carry out the procedure outlined in the superintendent's regulations.
Because that probably is the superintendent's guidance, right? Is to
Mhm.
just put them in the place of
Yep.
their guardian as soon as
Okay.
possible.
Stay with them until.
Right.
And then this was just for curiosity again, and we may have talked about it last time. So there's a provision about the receiving health records when a student enrolls or transfers. And that's, we only get health records when a student transfers within Pennsylvania. If they come from any other state, we don't carry the health records.
We can request them.
Okay,
Yeah, so there, I mean, there's an obligation, when it's interstate, for the sending school. And then, if it's a transfer student from out of state, just like Dr. Rushi said, I mean, we can ask, but there might not necessarily be that type of collaboration. And I don't wanna speak for, Ms. Battistelli, she can probably speak to it better than I can.
I mean, it depends on the sending state and, where the child's coming from, but we request them just like we would any other student.
Mhm.
It's just, in Pennsylvania, they have to send them
they
to
have
us.
to.
We
Okay.
don't, the laws in other states may not be the same, but typically we get them between the parent or the sending school.
Right. This paragraph seems to only apply to students who transfer from another district in Pennsylvania, so maybe we add a provision, or if transferred from elsewhere, the health records are requested at a minimum.
We can absolutely add that.
Okay.
I just have one small comment.
Mm-hmm.
Under private examinations, page 2. Now read, students may submit a required, I don't think the students are submitting this, parents or guardians. It's just a small change.
Oh, right.
They're students required, blah, 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 right?
Oh,
Do you see what I'm saying?
Yeah,
Like, the
parent or
students aren't
guardian.
doing it, and students aren't doing it at their own expense.
Yeah.
It's the parents or guardians are submitting their students required, blah, blah,
Yes.
blah, blah. Okay, it's just a
That's
small
good.
change.
We're not telling all the third graders.
Yeah,
to
I
do
know, right?
forms. So that was a little more substantial conversation, but this policy is one we've looked at a couple times. Do we think that those need to come back to the committee, or get those incorporated for read at a general meeting?
I think send it along.
Move it along?
I think so, yeah. I
Yeah.
mean, I don't think any of those were substantive. It was
No.
many, but not substantive.
Right, I agree with that. I think most of them are taking some things out, moving words along here and there. I do have about 10 bullet points of things that can be revised, but we can take a look at the revisions of that at the first reading.
Right, they're mostly cleanup in context,
Right,
not
right.
changing the
Not
purpose of the,
substance.
Yeah.
Mm-hmm.
okay.
So policy and AR 209 are gonna move forward. And this might be one that maybe can't be ready next
Mhm.
Thursday,
Next
but would
Thursday,
be
yep.
at the
Mhm.
meeting 2 weeks after that,
Mhm.
that's fine.
I will try my best.
I will not put that pressure on you.
Let's see what the
We'll
total
have
is by
this
the end of the
at
night.
a May meeting.
Yeah. The next policy is 210, medications. And taking a look at that, that wasn't too much. There was a request for a consistent reference to the district physician and the school nurse, that, that it remain consistent throughout the policy itself. That was the only thing that I had for the policy. For the administrative regulations, a request to have the definitions match, so that we would look at the definitions that were in the AR. So we noted there that a regulation fully incorporates all the defined terms that set forth in policy 210. And item number 15, there was a request, check with the district physician. So it's like midway through that paragraph, a little bit closer. So we have checked with the district physician regarding that list of approved medications. And that has been reviewed, so that's something that we would have a district physician do for us from time to time.
I think that the other change was that originally the licensed care physician was, licensed healthcare provider was defined in the AR but not the board policy, and now that has been moved to the
Been
board
defined
policy.
in both. Mhm.
Yeah.
Can you tell me why the optional section has a star by it?
That's in the policy, I was gonna ask that too. Those are optional
Maybe
definitions.
because it's optional?
No, they're like definitions.
Mhm.
Oh, that was so that, Dr. McKay, that's going back, probably to I think the last meeting. And it was an option to potentially incorporate the asthma inhaler and, the Epi-Pen in this particular policy 210. But we actually have a 210.1.
Okay.
So, I think
So should we read?
ultimately the decision was just to keep it separate and address
So is
it.
the 2.10.1 just the one that's labeled Epi-Pens?
Yes.
Yes.
Okay,
Inhalers and Epi-Pens, so these optional definitions, we can
Would
just
come out
get
of
rid
here.
of there.
so that means 210 by itself is not necessarily applicable to Epi-Pens. It's the Epi-10,
Mhm.
yeah,
Correct.
okay.
And then I think last time there was a pretty substantive discussion on sunscreen.
Right.
Yes, there was. But there was also one, I did have, page 6, a request to remove a school entity that prohibits, and that has just been reworded, if a student
Right.
is prohibited from possessing and self-administering. So we took out the reference to school entity.
Mhm.
Got it. Sorry, you didn't get to the sunscreen changes yet.
Well,
Never thought about sunscreen so much.
so you'll see what's removed, what has been removed there. And I think there was a renumbering.
I think the committee's desire was to, adopt the language from PDE's website.
Yep.
In lieu of, kind of the more black letter statutory recitation.
I think we had thought too, there are forms for this, for sunscreen. And if we could include links to the forms or include the forms somehow, references to them. We were looking for that as well. Just sticking to
Okay,
sunscreen.
thank you.
And the
I
very
missed-
important
yep, I
sunscreen
missed that one.
discussion.
Right. And, I mean, those could be forms, I'm thinking as a parent of kids who've participated in sports or things like that, I don't remember ever filling out a sunscreen form, so if that's something that would be helpful, yes, that they can administer it for a track meet or something else where they're sitting outside all day. I did actually have a comment on the sun protection for students, section. It says, the district may rescind or restrict the use of sunscreen if, and then it says that the student does not follow. So I think it would be helpful to put, the district may rescind or restrict a student's use of sunscreen, not like one
Okay.
child's behavior, like means
Now
that.
no
now
one
no
uses
one
sunscreen. Yes.
Okay.
other comments or discussion about medications?
We can make those changes and see if we can maybe move that one forward.
Mm-hmm.
Which then takes us to 210.1. And 210.1, I didn't have additional changes to it other than what had
So
been.
may have just held it with the
With-
others
Yeah.
wanting to
Because
move
the oth-
these
mhm.
together.
I think that's what I have in my notes as well. I didn't see notes on the changes here, but it
Mhm.
makes sense to not just
Yep,
move
put
forward.
them together.
Epi-Pens. Yeah,
Mhm.
right.
So, but the thing is that 210.1 isn't just EpiPens, it's also asthma inhalers.
Mm-hmm.
So those are two very different things, so I'm just curious. Okay. So it
Curious
isn't-
why they're grouped together?
No,
or
curious why I was like, is the document meant to only be about EpiPens, because that's what it was named, so I was curious.
The title is.
Yeah, I
is
see the
actu-
title.
Yeah, yeah. So the title, yeah, the actual document title will reflect both.
So I am curious these are a lot of steps that are being asked around the asthma inhaler. And I will say, my son has an asthma inhaler, so I know what the school procedure was when he got to middle school, was just like middle schoolers automatically carry their own. So here it seems like we're changing that there needs to be, so is that what we want, is the clear parents signing to make sure, like, it's not an age shift, it's much more about parents signing that they have the ability to do that? Because if parents don't, that means the nurses then are gonna have to hold it. And that's a whole lot of inhalers, so I just wanna double check that's what we wanna do.
Is this a substantive change in our current policy?
Or practice.
I don't know if
mean,
the
it sounds
I don't know
like-
if the policy or practice is different.
It sounds like it might be a change in practice, but
Yeah.
it doesn't seem to me like it's a change in policy. And then my question becomes, is this policy required by law for the parent to give that affirmative consent? And if so, then it sounds like we need to change our practice.
That's what I'm checking with, yeah.
Yeah, I was gonna ask Justin if that was, by law, because it sounds like you're hearing the middle school children would carry an inhaler. I've always been under the impression that this is what's been followed in all of our buildings. So,
I mean,
regardless of
my
age.
one very anecdotal experience was the expectation that they now carry it, because they're old enough to be
You
able to
didn't sign
self-administer.
anything in like Power
I have,
School?
I have no memory whatsoever of signing anything, but I do remember being, I just do remember being told that it wasn't an option to leave it in the nurse's office.
Oh.
Cause he doesn't need it regularly, and so that was like, well, can we just leave it in the nurse's office for the time that he might randomly need it? And it was like, no, we don't keep them anymore. And maybe this is also just poor memory on my part, so that's why I just wanted to check the difference between practice and policy on that.
Yeah, that's
yeah, it's my understanding that this is the process, that's in the policy that is being followed, so I'd have to check on
Yeah,
that.
again, my memory could be off, it just seemed pretty clear and automatic thing that happened, so.
Is the process as laid out in our policy, does that come from statute?
So I think you do have discretion, you have to have a policy that creates steps for self-administration. I believe you have some leeway at kind of the age or grade level and how you administer that between buildings or against the different age groups.
We have leeway under code, but we're not giving ourselves that leeway in the policy. Should we be?
It might be something we can consider, and I could bring back to the nurses
Yeah.
that treat at the different levels. Obviously, at the elementary level, this is what we would want to follow.
Yes.
Yes.
But we can talk to the middle school and high school nurses to see if that's something that they would consider appropriate.
Especially if it is the practice in the district and it's something that has been working well. That is, to Dr.
Mhm.
McKay's point, not something I think that we would want to change if it's, if, you know, in their medical opinion, that is working well for those students and that age appropriate
And again, it's just one anecdotal memory, so
I
it
mean,
could
yeah,
be
maybe
off.
you're wrong.
I'm open to that. I've made it very clear I'm open to that being wrong.
Yeah. Would it be okay to keep this one back, but move 210 and AR forward, and then we'll just come back with
we
this
can.
more,
Yep.
once we have more information?
Alternatively, we might just get an update to the board that lets us know, and we can continue the discussion if it moves forward to committee. If it doesn't require real working, like if there's a reason to largely keep it as is, maybe we.
Yeah, I think that
Yeah.
works. If it's that the nurses are saying, no, that was a mistake on that one time, we do wanna keep the policy, then I think we can move it to the board. But if it is something that we wanna rework because practice is different, then I think we'll wanna bring it back here for discussion.
We okay to move on? Policy 212 was first introduced at the last meeting, and there was a question about the rationale for combining reporting and grading of student progress. Previously, we had that as two separate policies, policy 212 and 213. So Jen has, in fact, worked with the principals, looked at this. The wording that is on here is either reflective of what the current practices are, or there was no turmoil over what is this, we can't do this. I think what we actually removed from the original piece that came was, some of the language that talked about contacting and how.
And conferences.
Yes.
Yeah.
And
The
just
last time
more
we-
getting along that parents need to know, parents and guardians need to be informed, and we tried to stay away from saying how that informing would occur.
Right, we wanna try and stay away from the micromanagement of how the policy is implemented.
This one, I think I had raised this question last time, and the word is still there, so I was just curious. It starts off with, the district recognizes its responsibility to keep parents, guardians informed of student welfare and progress in school. And I think I tend to think of it more of as progress, and then welfare. I wasn't curious what the context of that word is, like, especially on one that's called grading of student progress. Like, is that, kind of discipline or behavior, or is welfare kind of the first thing that we think of in reporting progress?
I can definitely see what you're saying, where that wording sort of connotes something different. I can imagine that because there are some behavioral items that get reported on elementary report cards, that may have been the word selected at the time. I think it would be accurate to say, informed of student progress in school, or if you felt there needed to be something else, it could be achievement and progress. And that way you don't exclude behavioral notations, but you're also not indicating it's more about something a guidance counselor or school counselor might report versus a teacher.
Yeah, I would suggest the emphasis on achievement and progress. Maybe there is some word that captures, whether students are meeting appropriate behavior expectations or things like that too, but welfare just seems like a much broader concept than it gets reported on a grading scale. And then, under guidelines, the second one says, ensure that both the student and parent guardian receive ample warning of a pending grade of failure or one that would adversely affect the student's status. And I know one of the new policies that we have is about retention, and so is that what status is, like, pertaining to like whether they would advance a grade, not like whether they are still allowed to be enrolled as a student? Like, status just felt like a more broad or consequential phrase than.
So when we think of status, that they they may, at this time of the year, they may not have enough credits to, become a
junior
sophomore,
next year.
a
Mhm.
junior.
Yeah, uh-huh.
So their status would still be that of a freshman, they're still in the building.
Mhm.
But the courses that they're taking to acquire the credits, that's what we think
Right.
of with status.
I don't know if there's
Versus
another way to
deferred.
say that affect the students' promotion, the students' progress, something like that,
Mm-hmm.
Promotion might capture it. Yeah.
And just to be clear, we are issuing report cards every 9
I
weeks.
was just about to ask that.
So not at every level. The elementary report cards are every 12 weeks.
We should have 12
So we
weeks
should
in here.
amend that to be.
Mm-hmm.
right.
Mm-hmm.
I'm gonna say I missed some report cards, if they've been coming every night.
So that's number 4, the guidelines specify the issuance of report cards at intervals of not less than 9 weeks.
Yeah, I was like,
Period.
oh,
I have that as crossed out. Do you guys not have that as crossed
no.
out? Okay, all right, so maybe I just crossed it out, but I.
Jump
And
ahead.
Salvi is the
Sorry
official
about
guide.
that. Okay.
Yeah, so
I'm
12,
sure that
and
that
so,
comes.
so every building is at least 12 weeks, that's the
Yeah,
shortest.
yeah, 12 weeks
or
is the
longest time.
shortest.
Okay.
I mean, sorry, the longest, yes.
Longest time. Yeah.
Elementary four.
That was my
Uh-huh.
bad.
Justin
Yeah.
is seeing that, was the whole
Yeah.
concept removed?
Yeah,
It's showing up as
4
removed
and
on
5.
Removed.
Uh-huh.
We have that in here.
But what
Yeah, so do we not have the
4
most
and 5
updated?
are removed, is what I.
Maybe not.
See, that's interesting. Because when I
Yeah.
printed it, it wasn't removed, but on my screen, it is
Is,
crossed out.
yeah.
So it must be some kind of formatting
Hmm.
piece where it didn't pick up the formatting.
So the proposal is to remove 4 and
4
5.
and
So the
5.
one about
Mhm.
intervals for report cards and ensure the continual review and improvement of methods of reporting student progress to parents, guardians.
Is there a reason we're getting rid of the report, like making sure that we're required to issue report cards?
Can we just have it specify the issuance of report cards at designated intervals? And that way, if we wanna change it, we don't need to put a time frame. But
Yep.
I think it might
Yeah.
freak some people out if we're like, no more report cards.
Yeah, yeah. Designated intervals.
Yep.
Right,
Got it.
yeah.
But I'm fine with 5 still going, because I feel
Mhm.
like that's implied in all the other
Yep.
Mhm.
Yeah, I
steps.
agree.
Okay, so.
Jen, were there any other differences between your printed copy
No,
and the?
that's the only, oh
Okay.
wait, let me see, under guidelines, no, that was crossed off. Nope, that's the only thing I had to
Okay.
cross off myself on my printed version.
Any other comments or discussion on that one?
And do we still, so for number 3, about parent, guardian, teacher conferences, we're saying K through 8, is that because there are not parent, guardian, teacher conferences after
Yes.
that?
Yes.
I don't
They're
have one
not
of those yet.
scheduled.
Right.
Yeah, you're right,
Yeah.
they are available anytime,
Okay.
a parent wants to speak with a teacher,
Right.
they're more than welcome to do that. It's just they're not scheduled or time set aside the school
the
day
fall,
for that, there's
spring,
no
okay.
early dismissal for it at that level.
You have a kid in high school and one in middle school, and the middle schoolers get half days, and the high schoolers
Yeah,
don't.
don't.
That's always fun.
I can't wait. I'm gonna
Right.
have one in all 3 buildings at some point, so they
There
can
you
all
go.
just
Right.
be angry at each other.
But then the high school does get half days for exams,
Mhm.
and then
That's
maybe a day
nice.
off for makeup, and so your younger ones will not be.
Yeah.
Do we have a comment from our videographer?
Like, don't change that.
Yeah, right.
Move along.
Did we lose footnote 2 somehow? Do we still need that? Cause I'm not seeing it referenced anywhere. It's still at the bottom, but it's not referenced anywhere.
Oh, there's one.
It got crossed off. I'm not seeing it if it's still there somewhere.
Yeah, I only see the
Yeah,
one.
it's gone, whether it's meant to be gone.
Okay, I don't know, just something to check on, but.
that citation does need to stay there, so
Okay.
thank you, Dr. Crispin.
Okay, yeah, I don't know if it refers to
It-
something
it's-
specific or
it's more
just
of like a
generally.
it's kind of
Okay.
one of those general supportive statutes, so
Okay.
I'm
For
actually
the
gonna,
general purpose or something.
I'm gonna take the two,
Yeah.
the number off of it.
Okay.
Remove the number.
Leave the
Oh,
citation.
And keep the.
Okay.
And I wasn't sure if one was cited, but, because it's hard to tell, but there, it is cited the very first sentence.
Mhm.
Mhm.
All the
Oh, right.
deleting is kind of
Mhm.
confusing
Yes.
sometimes, yeah.
Okay. Jen Saxa, how do we feel about an Oxford comma?
Oh, I'm a fan.
do we need
I'm
the
a
Oxford
fan of the
comma?
Oxford comma,
Okay.
personally.
We need
Yeah.
it? Okay.
We do need
Where do you
it.
see it? Did we miss it?
We're missing an Oxford comma, I think. That first sentence to that under purpose. No, second sentence, sorry. To that end, the district also acknowledges blah, 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 students, parents, guardians, comma. Well, we're here with your expertise, you know?
No, I'm
Parents,
with you
guardians,
on that,
comma,
yep.
And teachers.
Yep.
I'm not a fan of
I
this.
love it.
Absolutely,
Oh, no.
stand.
I was on law review and it has been beaten into me, so.
Yeah, I love an
yeah.
Oxford comma,
Yeah.
but you know, it's controversial. I didn't mean
Yeah.
to start controversy.
We
Controversy.
still use CMOS, is that a thing? That's what we use.
I don't know what that is.
The Chicago Manual of Style.
Oh, okay,
CMOS.
yeah, okay.
If
Look
we're
at you.
doing grammar checks, I would say the second sentence doesn't need to have the also. To that end, the district acknowledges that a system of grading student. I think that also in there is not really additive.
Do you want another one?
Also recognizes, yeah, so
Yeah,
the
'cause
district
there-
recognizes.
let's get into it.
And also acknowledges.
I started
I hope that
something
our
here.
council is writing all of this
This,
down.
this is good stuff.
So there is another Oxford comma in the grading section, that
Oh,
sentence.
man.
Grading, okay.
The student, it's the same sentence basically,
Mhm.
or the same
Same.
phrasing, student, parents, guardians, comma, and teachers.
Look what I've started.
Uh-huh.
Oh,
Oxford
We-
comma
we're gonna
revolution.
I'm a fan of the Oxford
comment
comma
from you
as well,
You
so.
are making progress.
I'm so sorry that I started this.
This one's
It's a
going to the board,
cascade.
though.
You're
We're
all-
bringing
Yep.
it to
Okay,
the
I
board.
know, I know. I do apologize. I do apologize.
No, it's actually easier to know that you prefer it.
Yes.
Because
Now you know.
I
Okay,
know I
now
do
you
write
know.
that way, and then sometimes I don't, depending on the,
Okay.
so
We'll
now that
figure
we're
it
all
out.
comfortable with each other,
Okay, all right.
I will incorporate
You
that
have,
moving.
you're familiar with CMOS, right?
Yes.
Did you use CMOS? Yeah, in law school? I'm
I
just
was,
saying, it was a thing.
I was the Journal of International Business and Law.
Oh, there you go.
I was not
alright.
on the law review.
Oh, okay.
Okay.
It's the same, they all use CMOS.
It's true.
So that one will move forward.
With its commas.
The commas.
With my apologies,
Like,
with
bring
my
it back.
apologies.
Do without you, Dr. Crispin.
You know?
As noted earlier, 627 is next on our agenda, and that was an oversight on my part. So we'll look at 912, research involving district students and staff, and the change that was made there. On the policy document, under the delegation of responsibility, number 2, it reads, prior written consent or an appropriate opportunity to opt into. We took out opting out of, opt into the educational research. And similarly on the AR, page 2, we indicated that they must opt in. And this is 3/4 of the way down the page. The paragraph begins, when an outside entity has been approved to conduct educational research. And then if you look, the third line of that paragraph, parents, guardians are notified in advance and afforded the opportunity to opt in.
We had discussed last time also whether we wanted to add a board vote
Mhm.
as a necessary step. I wanted to
I mean,
bring
you-
that
you
back
can.
up because
Yeah,
that
you can.
was something that was discussed, and I don't know what the board, is thinking about that suggestion.
That was a suggestion from a member of the community, and I thought it was a good point to make, especially since these are such rare situations, and the board approves other kinds of contracts and agreements. It seems like it fits under that practice.
I guess the question would be, would the board vote be one, it wouldn't be one where if it was just like an individual student, or would it be one if the district is granting some sort of broader, permission? And maybe they're not maybe they're not different, but that was my question, is, because obviously the purpose of it starts out that we will generally, the district will generally not permit educational research or surveys involving district students or staff. And under limited circumstances could be considered. And so would we want the board vote under any circumstance? Is that, if we wanted to do that? If, again,
Is your question for any request you want the board to vote, or just if the administration reviews some request, decides that this one has some merit and value and would want to move forward with it, then that's the
Right.
one that comes to the board?
yeah, right, that's my
You
question.
can add language to that effect under the, well, we can note it first in the purpose section to clarify.
That would be my recommendation
Mhm.
too, is to incorporate it into the policy itself.
Mhm.
Okay.
Something that's seen.
Is that something that we want to put forward, to add that step in as the board vote?
So if we think about the possibility of having a vote, what sort of information and or language would be used to describe said research during a meeting? One. Two, what language or written documentation will we be giving to that researcher, we'll say, that they would then have to keep as a part of their governing body research process?
Are you concerned about the process for giving us documents? Are you concerned about, because people know that there will be research, then the research will be skewed, or what are you thinking?
All of the above. So I
Okay.
want to make sure that we have all the wheels going. So yes, if we're going to vote, okay, what things come to vote, what language is a part of the vote, and potentially, what would we describe if Dr. Rushi says XYZ board has brought this to, and does anyone have any questions? Okay, if we have questions, what would be the next step? So is the intent for having the vote to have some board approval? Is the intent for having a vote to know what the research is about and inform what's the intent for having the vote? I think that will help guide what sort of process we would set into place for everything else that follows.
I guess it's up to us,
I think in my mind, it's, similar to other contracts or agreements that the board is asked to approve. It is because it is a use of the district's resources, which is largely going to be time and student contingent, right? That it has some merit or value. I don't know, I can't imagine what the circumstances of what would be presented, but I think this policy would allow the administration to review proposals, and find those seemingly rare situations in which they think that it's worth participating in, and that there would be some benefit. And I don't know how that would get described to us, but kind of like why we would have a contractor or a vendor to do professional development or something like that. Like, what is the value that the district gets out of it?
So is it information? Is it informing the board? Or is it the act of the board approving? Is that would be try to think, how would the board agenda item read? So is it that you're approving this work? Might be a different question to, another way, not different, but another way to think about some of the things Dr. King raised.
And just to,
Because it can be, sorry, Jen, it can be incorporated in there that the board has to be informed in writing or informed via a presentation at a board meeting, then that's separate from the act of the board has to vote to approve it. Go ahead, I'm sorry.
I was just, because we had talked about sort of the practical nature of this, you know, this might include something like someone's writing their dissertation. One of our teachers is getting their doctorate and they want to do, you know, a survey of fellow teachers about, you know, how much homework they give or what's their attitude toward, you know, purple binders or whatever, you know, like whatever people have. So, you know, if you're just to think about practically what that might be coming to you and what you would maybe want to be considering, those are the kinds of things that I would imagine. I mean, those are the only things that have come across my desk since I've been here as requests for research.
And so, go ahead.
Yep, you first.
So I guess like that's, I love the purple binder example.
Right.
Purple's my favorite color. But to that end, is that something that we would want to vote on? Because I don't think it's quite the same comparison as a contractor coming to do work. That's a different type, it's a different type of proposal. And so is that something that we as a board want to say yay or nay to? Or is that something that we are going to leave up to, you know, the superintendent, Dr. Rushi, whomever, to go through their checklist? I don't want to get into this, it feels a little bit potentially micromanaging. I know that we're trying to avoid doing that, so I want to make sure we're consistent and truly thinking about why are we having a vote?
Yeah.
Yeah, I think one of the concerns that was raised with this policy is that it's not always, potentially not always going to be a faculty member saying, let me do the survey. It could be a university, it could be a think tank or research, whatever. And then does that change the district stance? And while this policy may be on the books with our understanding of how we would expect Dr. Rushi to respond, some of these policies don't get looked at for 20 years, and, you know, like to have some parameters and guidance. And I think we don't have this policy now, and the administration brought it forward to help set some guide rails and transparency on how these decisions get made. I don't know if that fully addresses it, but like to think of different circumstances that may come under. Some seem completely benign and easy and micromanaging, and others may give cause to have more buy-in or, you know, approval, consent to move forward with something.
I wish that there were like, or maybe there's a way to do some sort of like magnitude guardrail, right? And so, I mean, because if you're thinking about the example that you gave, Jen, you know, staff asking their fellow teachers, how much homework do you give? That's not significant resources of the district, right? But to Bridget's example, where there's this contractor coming in and they're going into multiple schools and they're, you know, they're sitting there and watching students or any, you know, that's, and I think, you know, we've had a lot of comment on, not, you know, we've had significant comment on this one. I think that's what people are nervous about, right? That we would be spending all of these resources and time, energy on that, right? And not what's in our district. And so that would be something that, yeah, I would want the board to certainly be informed of. You know, that's one of those things I wouldn't want to get a letter from someone in the community be like, I didn't know this was happening, you know? And so that would be something that I would want to be informed about. And so I don't know if we can try and figure out some sort of magnitude limiter there on the board vote. What do you think?
I think that if the thinking is to go for a board vote, then absolutely there has to be some sort of parameter in place as to what.
Like a threshold?
A threshold.
Yeah.
And I do think that we, as a part of that, we have to be prepared to have the language and documentation to give that person or entity. Because who knows, whatever may be said or not said could potentially violate whatever governing body that they have to report to as well. So whatever we're gonna do, just make sure we're clear and that everyone is informed and it's documented.
So we can see what kind of language we can come up with, not by next Thursday
Right.
night,
No.
but perhaps a May meeting.
Okay.
Like, and if we can get language in there, since everything else is, pretty much moving forward, if we can put some language in there, then maybe it does go forward for first reading. If it has to come back to the committee, it went forward for first reading before, and it's
Right.
back at the
It's
committee.
back.
And I think the opting in language is already a significant strengthening and more of an alignment of the intentions, so some
Yep.
consideration on informing, approving by the board. Okay.
Okay.
President Wiedemann, we did also add, full clearances as a requirement.
Okay, yep.
So this is the last,
Thank you.
the last time.
Mm-hmm. What you know we up to now?
Now we are up to the policies that are new for us to take a look at this evening.
Right.
And that first policy is 200 assignment, 206 assignment within the district.
Are we announcing redistricting?
No, we are not.
Sorry, that was a joke. Oh, God. The emails.
206.
And there are administrative regulations with this one as well.
Am I correct in seeing that this policy ends up being only a couple of sentences?
Right.
Yep.
Okay.
Yep.
Okay, just want to make
Pol-
sure my copy is
The
correct.
policy itself,
Yep,
yes.
okay.
One of which is shall develop administrative regulations.
Yep.
There you go, it's working.
Okay, so perhaps it's late and I'm just having a hard time. The board is authorized to establish school attendance areas in accordance with law. Meaning that you live in this area, you go to the school, you go,
Mhm. Yep.
okay.
Yeah, the code specifies that by addresses, every child in the district must be assigned to a school.
Okay,
School attendance areas is a weird way to say that.
yeah, it is.
Yeah, I was wondering the same thing too, when I read that. I was like, what's a school attendance area? Like a catchment, a boundary?
Attachment, yeah.
Yeah,
Okay,
okay.
can we throw another word in there just for
Instead of areas?
School attendance.
boundary or
Boundaries?
boundaries?
Yeah.
I would, as if school attendance area is what the code describes it as, I would add it as also known as, or something, right? Not to
Yeah,
yeah,
replace
yeah,
school
yeah.
attendance areas, but
But that is confusing because I said that too.
What does 206 look like on your screen?
So we're changing school attendance area to boundaries?
I think we're adding, I'd recommend adding it since school
Okay.
attendance area may be what's in the code to just kind of describe it a little.
Yeah,
The board,
Okay.
I do see attendance areas
Am I
underneath.
looking?
So that must be the language, the
All
proper
right,
way.
I'm seeing something different here too.
Oh, no.
Should have a purpose,
Yes.
and the
Okay.
purpose the board directs,
Mhm.
and then authority, the board is authorized.
Mhm.
No, yeah, you know.
I
how
have some
to-
funny one.
You have something else.
See, this is what I get when I try to work on stuff too early. Okay, let me open up 206. Yep. Okay.
There you go,
Mm-hmm.
that's it.
Yeah.
It's still short. That's the, that's the,
That's the current
that's the
one?
current policy that as it exists.
Okay,
That's not good.
right, we're removing some of that language to a,
Create the administrative
Administrative regs.
regulations.
so then let me look and see that my. ARs are the same ones. Any other comments on the policy before the ARs? Do you have any introductory comments to the ARs on this one?
Just that a lot of it, as we just highlighted, was the, meat and potatoes, if you will, of the current version of the policy. The school code, kind of dictates, how the assignment process works, but it also grants leeway to the districts to kind of make best decisions, for the students based on a variety of circumstances.
I know I had some comments on this one. Anyone else?
Go for it.
All right. The first one's just kind of a introductory comment that the superintendent or designee may grant exceptions to this policy is how the general guidelines start, and I don't know what other exceptions to this, is that out?
No.
Okay, no, all right, I'm still looking at that one. I just felt like that part is a little redundant, like if the real intent is just to assign a student to a school other
Yeah.
than the one designated, I think that's more clear. So get rid of that grant exceptions part, okay. Under the boundaries section, one of the, requirements per this regulation would be to report to the board the status of school attendance areas, make recommendations. I wondered if there was, we should have some schedule. I mean, this seems, I'm thinking of it in terms of our facilities feasibility study, right? Like, it's not like we don't need monthly reports, we maybe don't even need annual ones, but like if there's some, every, not less than 5 years or something like that to consider the school's attendance areas or enrollment.
We do get reports on attendance and the buildings, I would say annually, don't we? I mean,
Every October.
it's felt like that, yeah.
Every October.
So, do we wanna put annually? I do appreciate, right, because we do have that, I know there's one specific day where we count all of the students, right?
October 15th.
Yeah, right, exactly, yeah. And I do appreciate getting those updates and just being apprised of seeing the schools, where they were at that point in time. And, I think a future board would want it annually as well. Especially since it's happening already, right? I mean, we're already taking stock of that.
It can happen annually without it being in a policy. I just would be careful when we put things in policy, they must happen.
Yeah.
Right.
Yeah, that's true.
Okay.
It's just, and
Yeah.
we do it, we do,
Right.
usually twice a year. Because
Yeah.
then David has been back to do an update on some things. Also, I want to perhaps give another example. So several years ago, we moved some programs from, and that we brought that before the board. That's not something we do annually. So,
Right.
It's not always, this has a broader definition than looking at enrollment and, space in a
That's a good point.
building.
Right. I
Then
guess
we
that's.
move a program.
Yeah.
Right. I guess that's what I was thinking though, too. Like enrollment is one thing, but then some sort of like state of capacity to say, here's the enrollment and the district is not recommending any changes to the attendance areas or, that feels like that should be something that is confirmed or at least considered and assessed.
Or just put
episodically, right?
periodically, I mean,
Mhm.
that way we're not committing to a
That'd be
specific
good, yeah.
time frame, and then.
Yep. Mhm.
Certainly it is something that this way there is a board expectation that it
Yep.
would be reviewed and
Considered, right? Like,
considered, yeah,
with the
which we know
enrollment.
that you're doing,
Yeah.
but.
But, yeah, to have that in writing.
Mhm. In the boundary discussion, it talks about the appropriate size of school with their ability to provide complete programs. And then I was surprised by how that phrase ended with adequate supervision with particular reference to a full-time non-teaching principal. That's number one under the boundary determination. Is just adequate supervision there sufficient?
Mhm. That would be. Yep.
Full-time, non-teaching principal.
Right, I just think that seemed kind of funny. Number two talks about the appropriate size of.
I'm sorry.
Oh, go ahead.
I didn't want to interrupt you, President Williams.
Yeah.
One thing I did forget to note was that this was last addressed in 2010.
Okay, so this one goes back a
Part
while.
of this is a byproduct of just,
Yeah, and it seems like a lot of this is not coming from code, right?
Mhm.
it's not.
Okay, that's,
Yeah,
like- it
this-
seems
yeah.
like this was just sort of like created, and so that's the way that I'm reading it, the language being used.
Okay.
And so I think that we have a lot of leeway here to
Mhm.
cut, revise, et cetera.
Mm-hmm. Yeah, so then number two says, the boundary consideration is by the appropriate size of school in relation to desirable limits of student population and availability of funds to provide necessary buildings. I think I read that with thinking, like, desirable limits should be something to do with like licensed capacity or something maybe a little, you know, a little more by code or something,
Capacity of student,
instead of just
capacity
desirable
for
limits.
student population.
And the administration of the programs
Mm-hmm.
in the schools, right? Because I mean, a school can have capacity, but like you were saying, Dr. Rishi, if we move a program from one school to another, you know, that could, you know, some programs I think just by their nature need a smaller classroom, right? But like the same size classroom, but a smaller class.
Yep.
And so that's a different issue than capacity. So I'm just
Mhm.
thinking something there about, you know, and our programmatic needs or something like
Yep.
that.
And then, yeah, the availability of funds to provide necessary buildings, and I thought that could be or renovations or enlargement to schools, like it's not just the buildings or. Right now, I was thinking of it with our current facility study, right? We have buildings, but like Antoinette said, the programs is affecting the way that those buildings are used, and though some of those buildings may warrant renovations or enlargements or something else that a constraint is the funding for and how those will get paid for. But when we're thinking of boundaries, that may be a constraint, like there may be space, an opportunity to expand the size of one building but not another, and so then that may affect where the boundaries are drawn on who would go to what could be a larger school than another one.
My guess is there's another section of code that requires the district to provide certain amenities within the school buildings, and so I'm willing to bet that that's kind of where this was drawn from.
Okay.
It's kind of speculation at this point, but I
Maybe
think
we
that's
can
why it's
look at
worded,
that.
I think that's why it's
Mhm.
worded somewhat awkwardly.
In number 5, it talks about local community identity relating to support of an individual school. And I didn't know how applicable that would be for like a board consideration where we're really just talking about the elementary
Yeah.
schools that all feed into one middle school and one high school, right? So, I mean, we're all part of the same community.
I had an issue with that one too, because the main paragraph says you shall consider it. And so if it had said may, and it would be, you know, all other things equal, you
Yep.
know, we try and keep, you know, but this is requiring that to be a consideration.
How
and
much
I-
do you love being a
Yeah,
Linwood Lion?
right, you know, I mean, as a fan, I've been part of 2 of our elementary schools, they're both wonderful. I've gotten to know people at all of them. They're all wonderful. And so, yeah, that rubs me the wrong way because it almost seems like an us versus them connotation.
Mhm.
And I don't like that either.
We can eliminate.
We can just remove that one if that's okay with everyone else.
And then number 8 is noted as a optional paragraph.
7 and 8 are noted as, consider deletion. It's rather unclear.
Mm-hmm.
Like in 8, why, I'm not quite sure why 8 even is, like,
Right.
community use of auditoriums and
No.
assembly areas.
Again,
how
and it-
that- How
and-
that influences
Mm-hmm.
when you're looking at the borders.
And because these are all required considerations, that one doesn't make any sense.
Right.
Can we go back up to number 3? Is there a designated distance, like mileage-wise?
Mileage-wise, no.
Is it more about time on the bus?
Within our policy and transportation, there is, like a recommendation about the amount of time on the bus, which probably is not a surprise, is becoming more and more challenging.
Yeah.
Just with Westchester Pike alone.
Mm-hmm.
Because I would think that in our district, given that we're small, it's much more about time on bus than mileage.
Right. Yeah, there are districts across Pennsylvania whose square
Yeah.
mileage is much, much greater
yeah.
than ours.
So do we need the language then, distance which students have to cover to reach school, if it's more about time?
Or could we refer to that other policy where we have the, you know,
Yeah,
recommendation?
mindful of the
Yeah.
transportation
Okay,
policy.
that's helpful.
Yeah, I like that.
Mm-hmm.
Because otherwise I could, someone could say, well, I feel this distance is too long, or.
Right.
Yes.
and
I
then-
don't wanna go more than a quarter mile.
Right, so then like, okay.
Right. And I also, just in the phrasing of that one, the required time necessary to cover the distance, I think it would just be the time necessary,
Mhm.
not the required time.
Mhm.
We might be able to reword that altogether to
Yep.
just, connect it back to.
Yeah, that's how I would do it, just refer to the other
Mhm.
policy.
What might a hazard or barrier be that the
Westchester Pike?
district is responsible for, not like the township and construction?
I just mentioned a highway as one, but,
I don't really know that would be.
I mean, I guess I want to make sure that the responsibility of the hazard or barrier is something that we can actually.
That we can control
Right.
in some way.
But
Yeah.
unless you have some additional duties I'm unaware of. Totally fine.
Yeah.
Nope.
Yeah,
there's a mean
not-
barking dog in front of that house.
There's been a lot of traffic lately. Can you work on that?
The road has been a mess.
It
from what
has
I've
been,
heard.
it has been, like stand still.
That's right.
So does that mean we want to get rid of 4 or reword it, or?
I mean, I really think that that is gonna be encompassed in our new number 3, which again, all of that just goes back to time on the bus.
Yeah.
I guess where it could apply would be if there is, because we do have distance for walkers, right? And so if within, is it 0.75 for elementary? Or miles, or whatever it is for our, like our elementary students, if there is was a highway or something right there, very, something very
That
dangerous
would be
they
in a
would have to
different
cross,
policy.
That would be, yeah,
Yeah, so,
yeah. And that's,
but that's the only thing I can think of for a hazard or barrier that would make
Yeah.
sense,
mhm.
right?
I would recommend, as you indicated, Antoinette, that we look at maybe the wording, the new wording for the third item that is there,
Yeah, and just combine
would
those,
just, yes,
yeah,
yeah.
okay.
Because hazard and barrier are all relative
Mhm.
Yes.
when it comes to transportation.
That's right.
Okay, the next section is on change of residence within the district, and it provides for moves before, after, the first quarter. I think number 2 would be more clear to say the student may finish the year in the school they first attended, provided that the parent guardian furnishes the transportation. Since we're talking about a move and there's a starting school and a finishing school, to say the one that they are attending doesn't clarify which of those it is.
Mm-hmm.
But our attending is where they are. They can finish.
I mean, it's possible they could have moved twice, so the first
Yeah.
school would not be the currently attended school, and then they're moving a
If a
third.
move
Mhm.
occurs
In
at the
one
end.
year.
Yeah, I mean, it's
After-
unlikely, but
No, it definitely could happen.
possible.
Yeah.
Yes.
So, but it says if the move occurs after the end of the first quarter, the student can finish the year in the school they are attending.
Presently attending,
Which one is that? That's the,
The one they're
But-
presently attending.
where they're going to school today.
Prior to
before the move or after the move?
It's,
They're where they're
Prior to the
going,
move.
because they haven't transferred anywhere yet, because they
Yeah,
just
they're not
moved, so
leaving.
they're still attending.
it's where they want to be.
Yes.
Well, that's basically what number 3 says. They can waive it all.
Yeah, right.
Yeah,
Where
number
they
3's
wanna be.
coming out of there. Number 3's coming out.
Okay.
Yeah, that should have
Okay.
been, no, that.
I didn't, yeah, I had some questions about
Nope.
that, like,
Then why bother having
Right,
it?
and it's like, never
You
mind.
don't just want to waive all the requirements?
okay, so
We're
that
moving.
helps that one.
Removing the free-for-all clause.
And then, so if a student starts the year at Chestnut Wald,
Mhm.
moves in March
Mm-hmm,
to Chatham,
mm-hmm.
this says the student may finish the year in the school they are attending. Which one is that?
Chestnut Wald.
Chestnut Wald.
Chestnut Wald.
Because it's the one that they were
They're not,
physically going.
they're not even
They're
going into Chatham yet.
Okay,
The house
They
might be
never
over
made
there,
the
but
move.
they're not there.
Yeah,
Like their house moved, but they didn't make the school move.
okay.
yeah.
If everyone else reads it that way, then I'm okay, because I was just like, which one is it?
But then they would move the next year.
Yes. Mm-hmm, mm-hmm. And as stated there, they provide transportation.
Right.
Okay. Yeah,
Dr. Rishi, how do you feel about this last sentence?
in the placement outside attendance area?
Yeah.
I had some questions about that one.
About the undesirable classroom conditions?
Yep, I didn't like that phrase, or even to say that we're making the decisions in the best interests of the district.
Yeah.
Which
I
feels
don't-
like we want to be student first, student focused. I wasn't sure.
In my opinion, this whole thing should come out. But. Because why? Isn't that what the rest of this is saying?
Mm-hmm.
This is just like
Yeah, if
it's like a
it-
weird
yeah, yeah.
summation.
The only thing, and I don't know, Nicole, if there's a different student matter that has arisen, but the only thing that I would see this would be applicable to, and it needs to be entirely reworded, would be the board recognizes that student placement outside the established attendance areas are sometimes necessary for programmatic,
Mhm.
Yes,
That
that's
makes
what it should
sense.
say.
for
For
programmatic
programmatic
reasons.
Needs, right.
So this is not related to if we were at capacity in a classroom at a typical grade level
Oh.
Mm.
in one
That's
building.
right.
Because
We've done
that's what
that.
I believe this
Yep.
is related to,
We've
is
done
that
that.
if we were, started the year and then we were at capacity in one of the buildings and a kindergartner moved in, but we were already at capacity in kindergarten, that student would not attend
Mhm.
their neighborhood school, they would attend a school that has availability within their grade level.
Well, then can we say capacity or
I think that,
programmatic?
yes.
Right, because undesirable
Means-
classroom
Yeah.
conditions.
No, that
is
means
not-
nothing. I don't know what that, I mean, it's weird.
So in that example that you just gave of the school is at capacity, then do we have language, or do we as a district provide transportation to?
We do.
Yes,
Okay.
if that, yes.
So just like if Chatham's first grades are kind of full and a new student moves in, the district would say, you know what, like, we'll get you to Manoa and you
Mhm.
can start your first
Mhm.
grade at Manoa mid-year.
But that's after the school year has started, right? Because when we have someone start before the school year, we make those accommodations to the classrooms, right?
We have had people start, like, the fourth week in August, we've not made accommodations.
Right.
To
'Cause
hire
at that,
a new
well, at that
teacher.
point, I feel like the school year has started.
Yeah.
I mean, right? It's like- But yes, okay, sure. I guess we can't put the start of school, but
Yeah.
when it gets that close to it and all of the capacity decisions have been made, right? Because that's when we get those people who say, I just moved in, it's April, we make those accommodations within the building. We're
Oh,
not saying
yes.
like, well, we already have 4 classrooms and there are
Yep.
25 students.
We've made those accommodations early in August.
Yeah.
It's really when we get later in the month.
Right, at that point, you can't create a whole new classroom.
Mhm.
Okay. Yeah, so I think we revise that to say, you
Mhm.
know, as needed for programmatic
Programmatic
or
and
capacity
capacity.
reasons,
Mhm.
yeah.
So this one needs a little bit more cleanup than some of the others, but do we think it would be ready for board review and discussion?
In May?
Or like
In
but not to come to committee again, but when it's ready to be reworked and presented to the board. Not urgent.
I don't know, you
Yeah.
might wanna see it again, but I don't,
We made a lot of changes to
Yeah,
this
we should
one.
see it.
Sorry, I just saw something else, sorry.
Okay.
Sorry.
Is it a comma?
No, it's minor, but, under, like, general guidelines, I was just rereading that section one more time. We have the, the extra lines at the bottom of the page, the one that starts twins and higher order multiples shall be assigned to class sections? Should that be,
I have
Oh,
to
is
assume that's
this-
coming from law, but if it's not, then we
Is
should
this-
just remove it.
hold
But
on.
is it a district, is it assignment within a district?
I guess I'm confused about that, like, I thought we were talking about, like, physical boundaries?
Catchment areas.
Catchment areas, so that was weird that all of a sudden, like, we're talking about, like,
A classroom.
and then I was like, wait, am I reading this wrong? Like, twin houses? No, twin children.
well, I would recommend we leave it because
Okay.
we would not have a policy on how students are placed into classes.
Okay.
But we would want some stipulation here, referencing twins, and
Okay.
otherwise that would be the only item in the policy.
Okay.
Twins, the policy.
So the question though is, what is the applicable law?
I'm curious about that too.
The applicable law, I happen to know.
Okay.
She knows.
Is that parents can request for them to stay together or for them
Okay.
to be separated, and the school has to follow the parent request.
Okay.
Parent guardian request.
Either one.
And that's a relatively new law, yeah. uh-huh.
Why do you
Didn't
know
know
that,
that.
Jen?
I have a particular interest, that's all.
Does that fall, I know the promotion one is on, but if there are twins or multiples that one of them is suggested to be retained or something, would that affect that as well?
That much I don't know.
That's a
I didn't
good
get there. They're only in
question.
first grade.
Right.
I have to go back. No, but we could look into that for sure.
I was just
I
curious.
think it's fine,
Yeah.
as long, we're only saying that it has to.
Follow the
it's
law.
applicable to law. Okay. I actually think that we should bring this one to the
Back to-
board, just because.
To the committee or to?
No, to the board, just because I think, what I'm envisioning is when we bring it back to committee, there are very substantive things that we're not sure which way we're gonna go, or if we're not sure we want to bring the policy forward. But I think this policy, we're definitely gonna bring it forward. And we do feel like, we do have, I think, very specific revisions. But, so, just to try and move things along, I think we could bring it to the board. But certainly if everyone else disagrees with me, then let's bring it back to committee.
The other thing too, I think the actual policy itself is like 3 sentences. It's really the
It's the
ARs we've been
AR,
talking
yeah.
about, and that's really, like, they
Mhm.
come to us, but that's not really our,
Yeah.
so,
What do we
yeah.
think? Is that okay?
I think
Just
that's
go to
reasonable.
the first read in
Mhm.
May?
In May.
I just have a question that doesn't, about moving forward. It's more, because this is an AR, is that why the applicable law is not cited?
Not necessarily. I mean, I think more recently, there's been requests to cite it with specificity, so if that's a request of the board.
No, I just was curious, because it doesn't, like, in general, it seems like we stay away from footnotes more in the ARs, so I just wasn't sure, yeah.
Well, Dr. McKay, there really are no footnotes. What we've been doing when there's been a request to add it, we'll just, add a direct citation to the.
To that
code- the
one
provision in the
particular
code,
point?
or- Yeah.
Okay. I don't necessarily think it's warranted, I just was curious.
I think we have time for one more policy.
I was just looking at the clock, yeah,
And
quarter of.
is there a preference for which one? I.e., is there a preference for records management?
Over the other ones
Over
were
the
class
other ones?
profile,
Class
promotion,
profile is short.
retention.
We could probably go through that quick.
I just am not sure if the district just wants to move along the records management, that's all, because that's something that I think that we have.
We've had that on the,
Mhm.
on
On the
the
agenda,
agenda
yeah.
a few well, twice, but we've had the others on there, as well.
It's up to you, Dr.
If
Rucci.
if we can start the conversation with the records management and get a sense of the questions.
Yeah.
I mean, I'm not assuming records management is moving forward to the board.
Well, this is this is one that I wouldn't be surprised we did talk about for a little bit, because it's a brand new policy,
Mhm.
and it is pretty intricate. So, yeah, I just think it might be prudent to get the discussion started.
Mhm. So maybe if we could allocate a few minutes to have the discussion about this one, and then the other two that Jen worked on with the principals are the class profile, promotion, and retention. So if we knew there were specific questions about those, that she could have a takeaway from there.
Okay, so we'll do a blitz couple
Mhm.
of
Couple
minutes and then leave time for public comment.
Okay.
On the 800 policy for records management, I feel like the purpose, failed to really capture some of the broader concepts or responsibilities that the district has. It doesn't talk about like safeguarding privacy, being attentive to cost or, kind of legal requirements, and I felt like that needed to be a little more clearly put forward as the goal. Like, the goal is that we have a policy that protects student and staff privacy, that we have safeguards in place, and that we not just do things like in accordance with law, but yeah, have a more sense of trying to comply with some of the legal requirements.
Dr. Rucci, it's just, wouldn't that be under policy 216, the student records and confidentiality?
The confidentiality.
Okay,
This really is what we are, to reduce this to what is the action associated with it. This is how long do we have to keep stuff?
Yep.
Okay.
Right.
And that's really what it comes down to. So what's the expectation for an employee personnel record? What,
Yeah.
Student records, records in applications that come into, HR, all of the various reports that have to be generated.
but the reason we want to get rid of stuff is to minimize our risk and cost too, right? Like,
Space, cost, streamlining, yeah,
The
there's
burden
a
of
lot of reasons, yeah, the burden of having things that are superfluous to the actions, the day-to-day responsibilities of the district. So, my reading of the policy, is that I want it to be more focused on what to destroy, not to what to retain. And I'm saying that looking at, how to assist employees in determining what information, documents, and data should be retained and what information, documents, and data need not be retained. And I guess I was just envisioning something more along the lines of, in the policy, we would have, maybe we don't have the exact time, although
Well,
I think that's a
we do,
consideration.
but, I'm just realizing, it's not clearly, if you open up the AR, there is an attachment down at the bottom of the AR. And that
Okay.
does
I saw that.
articulate, that's about 9 pages long of all of the various records that a school district has. And then identifies like the disposal code, what is meant by, like what that disposition of records sort of categorizes it, I guess, in a way. But then looks at the retention period in years.
Okay.
So, for example, we just had a feasibility study recently completed. The recommendation on there is, that a feasibility study would, be retained for 3 years. We might have something longer than that, but after 3 years, you might want to have it updated in some way. Whereas PSSA, Keystone exam results, that's permanent.
This is very helpful. And this has all been reviewed by the solicitor?
So I would love to take credit for this. But, a couple of years ago, PSBA, it was a
This is Lower Merions, I think.
actually, the schedule itself is a PSBA model, document. A couple of years ago, it was painstaking. They took the time to go through.
Yeah, it looks.
And I think there's somewhere between like 50 and 60 citations, because some school records have specific requirements for maintenance or preservation. Not all of them do that are in the proposed schedule, but pretty much all of the ones that do, they hit. And there's federal code citations, there's state law citations. So it's useful. The only other thing that we might be able to do is make this a little bit more user-friendly. So if you wanted the actual legal citation kind of within the box to go along with the recommended time period, instead of having to look at the bottom, that's something that we could do.
I don't think we need that.
But, yeah, so, yes.
It just would be too busy, that's all.
So the 2 items that are in red, is that because that's something you're currently kind of debating, or, so like one is
Yes.
page 6?
Is that the
Yeah,
videotapes?
yeah, that's the rotation of
Yeah,
routine ones.
yes, that's a notation for me to mention. That's the capacity that we have right
Okay.
now, and the recommendation because of the quantity of cameras that are located
Sure.
all across our facilities, particularly outdoors, on the main entrances to the buildings, so that we would maintain the footage, if you will, for a 2-week period of time.
And then the emails, that read as well. So that's up on page 2.
So the emails for us would look at a 4-year period of time. And that comes into just like storage of,
Sure.
as I said, similar to a video, but a video requiring, much more. But the server space, whether it's a virtual server or an actual server that's physically in a room, that's what we're looking at there.
Are there prohibitions on deleting, say, an email, like, within 4 years? Like,
No, I mean, there's a lot of overlap in different ways, right? So there's also, one of the important points to note is there is a very robust section on litigation holds. So if there's an issue where a school record is going to be pertinent to a potential matter of litigation or a dispute, whether that be discipline all the way to potentially a major litigation, there's steps in place for records or recordings to be preserved, but there is not a specific prescription, President Wiedemann, to maintain all emails for X amount of time.
So in terms of like, just the time it takes to dispose of the things as are listed, are there opportunities for it to be automated, i.e. email? Do we have a program that will automatically delete after the 4th year and things
Yes.
of that nature? Okay. And so for the things that cannot be automated,
We'd have to put processes in place.
okay.
I mean, it's also a policy too, that staff could refer to when they say, oh, I found this document from 8 years ago,
Yeah,
can
how
I get rid
long
of
to-
it?
Yep.
And then there's a policy here,
Yeah.
right, that
Well,
says
yeah.
very clearly, Yes,
As
right.
as a person who has stacks of old exams in my office, it's really nice to know, like, after how many semesters can I get rid of these old
Yes,
exams?
right.
Especially like hard copy stuff that's taking up a lot of space. Like, it is really useful to know, I have to hold it for however many semesters or, whatever, how many years. I think there's a lot of value in that.
Do you wanna add to that, Nicole?
I get that question all the time, but
Yeah.
because we don't have a records retention policy, we don't have an answer to that question. And, teachers
Yeah.
like, well, when can I get,
Yeah.
when they
Yeah.
have filing cabinets upon
Yeah.
filing cabinets of things.
Or just
We need that
correspondence with
space.
students or
Yeah.
correspondence with parents or
Right.
something, like,
Right.
you might have questions about. Yeah, I definitely think there's a lot of value in it.
Absolutely.
I would definitely change the name of the policy. I wouldn't call it records management. I would call it records retention, because that is what it is. And that's what it says in the AR. It refers to records retention. So I would call it that. That would be my recommendation. But yeah, I definitely think there's a lot of value in having some formal instruction.
Okay. I love this conversation, but it is 8:56.
Yeah.
Do we want to pause here? We'll start on this one next time.
Mhm. Yeah, so if, perhaps if people wouldn't mind taking a look at that attachment in particular.
Yeah.
And just, are there some things that you've got questions about? Because, there are some that we have to, annual financial reports, annual audit reports, they have to be kept forever. So the list does go anywhere from, 1 year, or just as long as you have the current document, to it has to be kept forever.
I've done a quick search and I can't seem to find it. So what about IEP requests? Are those things we have to keep on forever, or IEPs? I was trying to see if I could find
No.
that in this list.
I would have to go back through the list.
Yeah, I tried to do a search, but my computer's not
Okay.
really.
I'm almost certain that's in there, document.
Yeah,
Yeah.
okay. Then I'll spend some time on it, yeah.
So this one is not ready for.
No, we'll
No,
bring
we'll
it
talk
back
about
here.
it more.
Yep.
Yep, okay, so we will save class profile and promotion retention. Are those urgent to get some feedback on? Then with the last couple of minutes tonight, we welcome public comment. State your name and confirm your residency in the township.
Hi, Sarah Johnson. I'm a resident of Haverford Township. Yeah, I just had the question about policy 912, which I've spoken about a couple of times. I think really the concern, like Dr. King, I know you had brought it up. I think really the concern is really transparency whenever we're bringing in outside entities. And like, I think my question, the question that I was hoping a board member would ask, is why does this have to be an AR? Like, why couldn't, because that just means that it only comes before the superintendent. So if it comes up so infrequently, even if it comes before the board, I just don't see how it's taking up that much time just to vote on it. And I do see your point, Dr. King, that maybe it's just something like, like we said, a teacher is doing dissertation and they just want to do a survey and it's on something simple. Well, that should take the board, all of 2 minutes to vote on and it'll get approved. You know what I mean? I'm just wondering why it has to be an AR. And like, Ms. Aska, I know you said like, really that's normally what comes up, but like the Biden-Harris administration, I don't know if you know that, but they just announced there's going to be more federal funding for community schools. So I think there is going to be a lot more outside entities coming in and there's going to be a lot more federal funding for that. So I think this is going to become kind of a more common thing. And I know a lot of the school board members ran on transparency, and I think this is a chance for you to put policies in place that are transparent, because I just don't see why this has to be an AR. And my other question is, like, we're asking the solicitor to go back and rewrite the policy to somehow, like, I don't know how you're gonna be able to do that. And if you're billing by the hour, I just don't know that that's really the best use of your time. Like, is that the directive at this point? Like, we're asking the solicitor to go back and figure out a way to rewrite policy 912 so that things that are more simple can be just approved by the superintendent. Like, I just find this directive kind of odd.
I'm just curious, well, one, I think the administration is taking the, board's discussion of, if the board would be informed, have a vote, that's something the administration would work on, and then our council helps with some of the legal drafting or making it consistent with other policies. But I'm not following your concern about ARs, like.
Well, so basically the AR, so say like say, for example, the Epi-Pens survey, that was voted on by the board. So the community knows that these surveys are going on, that University of Pennsylvania is collecting this information. But once you let an outside entity in to do surveys or things like that, then it's only approved by the superintendent, which at this point is Dr. Rushi, but it could be anybody, like you said. And I do appreciate you bringing up that point, Ms. Whiteman, that like we have to think about this 20 years down the road, 40 years down the road. It's not just always going to be this board or Dr. Rushi as the superintendent. So you have to think about it long term. But that means that there is no transparency, that these surveys could be given, or not necessarily surveys, but outside entities could come in to the schools and the community wouldn't be aware of that. So there could be research being conducted in the schools that the community is not aware of if there's an AR.
I guess that's the disconnect, because the AR just is the procedures that go with the policy, like what the administration would follow. And within the language of the drafted, which is not yet board policy, but the draft says that there would need to be an opportunity to opt in. So there would be.
I know, but the opt-in doesn't really work. I mean, the opt-in policy now doesn't work.
There's not a policy now. This is new proposed language. So
right now we have an opt-out, like for the surveys, there's an opt-out policy, so the policy.
I think that's a different thing. So this would be, so I think like the PSSM, is that what you're talking about?
Was that the UPenn survey, PSSM? Mm-hmm.
So that's not outside research, that's something that the district, like that is a.
And I said that in that case, the community knew about that, that was an open board vote.
Okay.
But I'm saying this policy 912 with that AR, doesn't that mean that Dr. Rushi can approve certain outside entities without board approval? Isn't that what that policy is saying?
Well, that's what we're currently discussing.
That's what we're discussing.
Yeah,
Right,
so we
that's-
haven't come to a decision on that yet, and that's why we were thinking, maybe there are some instances when it doesn't need a board vote, like if it's a teacher just asking a couple other teachers, informally or whatever for her dissertation. But then, maybe when it is an outside entity coming in, observing students, so that's sort of what we are thinking about now. And I appreciate it. It might have been you that brought it up, that maybe a board vote would be, and so I definitely took that under consideration. I think that's a good thing to consider.
What I
and that
heard
was
too- sorry.
And that was our, the next step for the district, is to think about when would we want that, right? And are there scenarios when we wouldn't want it? Maybe there are none, maybe there are some, and how do we put that into policy so that everyone knows what's going on?
Yeah, and the other issue that I think does go along with this is, I think we have to be really careful about protecting students' data. I mean, like I've mentioned before, I think the students' data is worth a lot of money, and I've been asking this question since January, like with that PSSM survey with UPenn, can that data be repackaged and resold? And I got one response from UPenn that was very like, it can basically if somehow the district does sign off on it. It was like a very vague answer when I tried to follow up, and I did try and contact somebody with the Catalyst program. So like, as somebody in the community at this point, I can't get an answer to this question. Dr. Rushi has been looking into it for a long time now too, and she hasn't been able to get an answer. So again, I think we have to be careful whenever we're dealing with outside entities, because these aren't, like UPenn, they keep pushing me to like their FERPA policy, but it's not for people under the age of 18. Their FERPA policy is, for older matriculated students. So I don't think UPenn does usually deal with, K-12 students. but a lot of the, you know, everybody's kind of getting into this industry now. So again, I just think we have to be really careful, because I think this can be a big loophole, for, you know, for students' data to be collected, and so I think transparency is extremely important, especially now. You know, I think a lot of things are changing in the educational, you know, arena at this point, so.
Yeah, thank you for voicing your concerns. I think they've been beneficial and have added to this committee's deliberation, and the previous draft was sent back to this committee to continue the conversation, and I think we continue to see some changes, and we'll have another opportunity for a first read, second read.
Okay, yeah, no, I appreciate it, and I appreciate you, you know, the AR thing is kind of confusing as to exactly, and I'm sorry if I haven't, you know, articulated it well, but thank you for your time.
Thank you. All right, with that, the business of this committee is concluded and the meeting's adjourned. Thank you.
Thank you.